Welcome, curious minds, to another deep dive. When we think about mental health care, it's easy to just picture, well, modern therapy, maybe medication. But what if I told you that the story, the real journey of understanding the mind, it actually goes back thousands of years. It's evolved from ancient wisdom right up to today's science.
It really has. It's a history that's, frankly, much richer, more complex than many of us realize. And today, our deep dive is digging into exactly that. The evolution of psychiatry in India. Our mission, really, is to uncover how mental health care transformed there. We'll find some surprising facts and trace those critical shifts.
Yeah, and what makes this particular exploration, I think, really special is where we're getting our insights. We're looking at this through the eyes of a practicing expert. Our source is The Evolution of Psychiatry in India, A Healing Journey by Dr. Vinay Kumar. He's a founder, director, and chief consultant psychiatrist at Manasvi Hospital. So you get this frontline perspective.
Exactly. It's not just academic history, it's lived experience informing our understanding of how the field progressed. His perspective will really help us, trace this whole incredible journey.
Okay, so let's start right at the beginning, way back.
Right. And what's genuinely fascinating is just how old these roots are in India when it comes to mental health. We're talking the earliest references, believe it or not, back in the Atharva Veda.
The Atharva Veda. Wow, that's one of the ancient Vedic scriptures.
Precisely. And it's not just philosophy. It actually includes hymns, charms, specifically for healing. It talks about mind-body connections, which sounds very modern, right?
Yeah.
And it proposed healing using things like mantras, herbs, even rituals.
And it wasn't just like vague spiritual ideas, was it?
Yeah.
Because then you have texts like the Charaka Samhita and Sushruta Samhita.
Yeah, those are foundational Ayurvedic texts. Think of them as ancient medical encyclopedias. Really comprehensive. And they got specific. They actually categorized mental disturbances. They described conditions, unmada, which is sort of like insanity, and apasmara, which relates to epilepsy.
So they were trying to classify and understand these conditions medically, even then.
Absolutely. And here's the kicker, the really surprising part for me. These ancient physicians, they understood that mental illness wasn't just spiritual. They saw biological roots, too. The source actually calls them far ahead of their time for grasping that.
That is incredible. That blend of biological and, well, maybe psychosocial or spiritual understanding.
Exactly. And Dr. Kumar, in the source material, he notes how modern psychiatry is, in a way, coming back to that, re-embracing that kind of holistic view, but now with, modern scientific tools backing it up.
It really makes you think. But okay, history moves on. India enters a different era. The 18th, 19th centuries, British colonization arrives, and with it, Western-style asylums. That must have been a jarring change.
Oh, completely jarring. A stark departure. Suddenly the focus shifts. It becomes primarily about, custodial care, isolation, getting the mentally ill out of sight, essentially.
And the conditions in those early mental hospitals, Bombay, Calcutta, Madras.
The source uses the term deplorable conditions. So,
Yeah.
grim. It was less about healing and much more about containment.
A really tough chapter. But ironically, even these places, with all their problems, they did lay some kind of foundation.
Paradoxically, yes. Despite the harshness, the focus on custody, these institutions did establish the very first structures for organized psychiatric care in India. A complex legacy, for sure.
A complicated beginning that sets the stage for what comes next, post-independence.
Right. After 1947, India gains independence and things start to shift again, significantly. Psychiatry begins to emerge, to really become seen as a legitimate medical field, not just locking people up.
And you start seeing key figures step up, right? Pioneers.
Exactly. People like Dr. N. N. Wig, Dr. Vidyasagar, Dr. Deela and Murthy Rao. These were individuals who really drove the transformation. They weren't just practicing, they were actively building the discipline.
And then there was the establishment of that major institute.
Yes. The All India Institute of Mental Health in 1954, which of course you'd know today as Niyam Hands. That was huge. A landmark. It signaled a massive shift towards proper research, professional training.
And community psychiatry, too, you mentioned, moving beyond just the big institutions.
Critically, yes. Thinking about mental health in the context of public health, not just confinement. So slowly you see psychiatry moving out of those isolated asylums and into general hospitals, and awareness, bit by bit, starts to spread.
It sounds like a gradual opening up, both medically and socially.
Which naturally leads to thinking about the laws surrounding it all, the legal framework needed to catch up. India's journey here is quite something. From the really outdated Indian Lunacy Act of 1912.
Lunacy Act. Wow, the name itself tells you a lot.
It really does. Very archaic, focused on lunacy. But it moved towards something much more progressive. The Mental Health Care Act of 2017. the MHCA.
Okay, MHCA 2017. That sounds like a watershed moment for patient rights. What's the core change there?
It's fundamentally about putting the patient first, a patient-centric approach. The MHCA legally protects patients' rights. Things like informed consent, you have to agree to treatment. Confidentiality is guaranteed. Access to emergency care is mandated.
So it's about dignity, respect,
Yeah.
treating people as patients with rights, not just cases.
Precisely. A much more humane framework. It's a profound shift legally and ethically.
Okay, let's fast forward now. We've come a long way. Let's talk about the modern era. Psychiatry in the digital age. It feels like it's exploding beyond the hospital walls now.
It really is. And digital platforms have changed the game. Online therapy, for instance. Plus, you have all these awareness campaigns. People are talking about it more. Even things like celebrities sharing their struggles. That's actually had a noticeable impact on reducing stigma.
Making it okay to not be okay and to talk about it.
Exactly. And alongside that accessibility, the medical side is advancing rapidly too. Think psychopharmacology, better medications, neuroimaging, seeing the brain differently, brain stimulation techniques, new psychotherapy integrations. It's moving fast.
And it's not just about treating illness anymore, is it? There are concepts like emotional hygiene, burnout.
Yes. Preventive psychiatry. Fostering well-being, not just reacting to sickness. Dr. Kumar in the source really emphasizes this broader vision, blending these new scientific advances with a continuous focus on mental wellness.
Which brings us right back to Dr. Kumar's own experience. 16 years practicing, watching this unfold. He says India is at the beginning of a mental health revolution. That's a bold claim.
It is bold, but he backs it up with what he's seeing on the ground. He points to a definite, tangible reduction in stigma. That's huge.
People feeling more able to seek help without shame.
Yes, and a clear rise in help-seeking behavior. More people are reaching out. And critically, families are getting more involved, supporting treatment, recovery. That's vital.
And his own hospital, Manasvi, tries to embody this.
Absolutely. He co-founded it with this goal. Blending compassion with top-notch clinical practice, and importantly, integrating that ancient holistic wisdom we talked about right at the start with the very latest in scientific approaches. It's like the journey's come full circle, in a way.
Wow, what an incredible arc we've traced. From ancient Vedic insights on the mind-body link through the really difficult asylum era, then that post-independence dawn with new institutions, new leaders, and landing here in this modern digital age focused on rights, access, and this holistic well-being idea.
It really highlights resilience, doesn't it? And innovation and just fundamental human care evolving over millennia.
Yeah.
And you have to remember this whole story. It's not just about systems or laws changing. It's fundamentally about people, individual minds healing, lives finding meaning again.
It reminds you that healing is always a process, always evolving, shaped by so much history, culture, science. So as you, our listeners, think about this journey, maybe consider this. What could this blending, this careful mixing of ancient holistic wisdom with cutting-edge science mean for the future, not just in India, but globally? And maybe, how does understanding this long, complex evolution change how you think about healing, about wellness?
Yeah, something to really chew on, a powerful history with lessons for all of us, I think.